5, 4, 3, 2, 1, fade my cue.
Kim, you're here to tape 3 shows today?
Well, it's very exciting. We're taping 2. We have one with a national expert, Marianne Davis, and then we're taping one with Peter Evers. He is the Vice President of Operations at the Home for Little Wanderers. Then we're going to go live with the Commissioner of Mental Health, Marcia Fowler.
A new generation of folks that we're serving, and we're not going to be serving them for the rest of their lives.
It's Children's Mental Health Awareness Day, and we're really excited about it. It's such an important cause to really raise awareness around children's mental health, and this is the best way to kind of get it out from 3 different areas to kind of say, okay, what's the perspective of Marianne Davis, who's a national expert? She's going to give us tips on how to help children. Then we've got someone kind of on the front line saying, okay, this is the Home for Little Wanderers, and people think of them as an orphanage, but now they're branching out and really helping children and helping young adults transition into adulthood and reach self-sufficiency. So that's from an actual program standpoint. And then we've got the Commissioner of Mental Health, Marcia Fowler, who's new, and she's going to show us her vision of what the Department of Mental Health is here to help and how they're going to help transition-age youth. So it's really a fantastic combination to celebrate Children's Mental Health Awareness Day.
It's not as obvious. We don't do the accountability. Say, for example, we don't follow the outcomes into young adulthood for a lot of people who are served in our systems as children or who have gotten some kind of treatment for a mental health condition as a child. So it's harder for us to become aware on a regular basis. And when we do, it's for horrible reasons. It's because somebody has taken a gun and shot into a crowd at a college. And then we hear the specter of mental illness being present. And so we get this very extremely negative type of news about it, and which just makes young people scary to folks who then aren't thinking, well, how can we help them more so much? It's more, how can we contain them and stay away from them?
I see myself with a bachelor's degree in psychology, living on my own, of course.
Fantastic.
Riding around in the car because I hate taking the seat.
I hear you, I hear you.
And maybe with a beautiful lady by my side.
So I think the most important function is to be part of the solution for the journey that young people are on. I think what we do and what we try to do is give people direction rather than sort of telling people where they want to go and giving them pathways for a future which is successful and fruitful, really.
And that's what we're trying to do. This is a planning grant through, it's called Stay Together, Success for Transition Age Youth. And the grant is really a planning grant to help determine where the service is lacking and how can we enhance the services to make them better fit the needs of the young adults. Because right now there's only about 80 young adults in the services, and there's about almost 4,000 young adults in the Commonwealth that could be eligible for services, but they're voting with their feet. They're not showing up. The services are not meeting their needs, and there's a greater propensity for homelessness, teen pregnancy, substance abuse, all these different school dropouts, and all these young adults could end up on the rolls on Social Security disability, if someone doesn't intervene, or worse, they could end up really in violent situations, in dangerous situations. So we need to intervene so that they can reach self-sufficiency, so they can reach their full potential, and that's really the goal of the grant, to figure out what services they need. And sometimes the services that they need are small interventions that can make a huge difference and help them become productive, happy, sustainable individuals in the Commonwealth.
What do you see as the promise in these kids that makes this such an important issue?
Well, in age, I'm not too far apart from them. So I just tell them the biggest thing is don't let nobody bring you down.
Well, I think what we did was we were part of the System of Care for Children's Behavioral Health Initiative. What they found was that young adults were not making use of the service. We were very interested in being a solution to that because we provide that service. The idea was bring in, again, people who have used the system, peers, peer specialists, and ask that question of those people who use the service so that we can research that and then pilot other projects which really will find a better way to engage young people in the system and then replicate it. And so that's really, we want to be at the beginning of that process and then help with the answers for it.
So Kim, how do you get this out to the actual individuals who can use the help?
That's a great question. It's the young adults who inspire me. I get to work directly with the young adults who experience psychiatric disabilities, and their ability to kind of just cut through it, and they'll just say, Kim, this is what we need, and why can't we get it? Young adults want the same thing that everyone else wants. They want, intimate relationships. They want affordable housing. They want to be able to have a job that's meaningful to them, and we can help them with that. And a lot of times it's helping them learn what an informational interview is. How do they network? It's, helping them with a resume. It's connecting them to someone who might care about them, who might take the time to help them reach their full potential. So it's really the young adults who kind of get me out of bed every day to say, we can make a difference. And they're so fantastic. Like we did an intro for the new cable show, and the first round we did, we'd asked them, but they were like, the pictures aren't right, the wording isn't us, and they said it in a very colorful way, and you have to have, kind of thick skin. But what we came up with is fantastic, and you'll see that later on in the show, and it was really the young adults saying, that doesn't reflect us, those pictures don't look like us, that isn't what we'd say, and what we came out with was a great product, but they know we listen to them, and I think that's why I'm able to work with them, because they know that I'm listening, they know that I care about what they want to do, and ultimately we care about their best interests, and that's why we're in it, to make a difference. And you can see, I've seen young adults that have been very disenfranchised, disillusioned, and really kind of not caring about anything. And when you sit down and kind of help them figure out, well, what are you looking for, what do you want, and that we're really here to help, and once you do one or two concrete things, then they can really see, wow, this person does care. And it's the little actions that you see they're registering, because they've been through a lot of very unfortunate, a lot of times traumatic situations, both in their lives and through the system. So to try and make a difference and turn that around, we can see the young adults kind of lighten their eyes, come back. It helps me go forward and help more young adults.
My main thing is their safety, and as long as they're safe, I'm all right with that. Just the other day, one of them said they wish they could be like me, and that says a lot, because I doubt myself all the time, and I guess other people see the potential in myself, and it's great to see the smile on their face.
On the other hand, I think people who are in the service systems that our public tax dollars support, they are increasingly well aware. And in Massachusetts, we're actually one of the leading states in the country in trying to address better the needs of this age group. What's hard is to look at the degree to which we're still limited in doing that and realize that's one of the leading states in the country. So I don't think that there's an easy answer, except what I like to ask people to do anytime they're thinking about a program or support or some type of funding source that they think of as either being limited to children, to think about up to age something like 18 or 21, to think about how much more important it would be to maybe extend that support or program or service up to 25, maybe even up to age 30. Because when we look at the typical young adult, it's really only after about age 30 that people are really settling into their mature adult functioning, the way that we want them to be as adults. And for us to expect people to be able to function as mature adults before that is really more than we should be expecting from young people to be able to do, particularly when they have this kind of disability.
What are sustainable practice enhancements?
That's a great question. It's really to enhance the system. So it might be to get sustainable, like career development advice, sustainable practices, like it could be social media. We work a lot with our Facebook and our Twitter account, so they'll always have access to finding out the resources that they need. It might be individual services. We're launching or we're increasing the parents' support network. So there are a lot of parent professionals, and they're helping support the young adults. So helping to kind of create services that will be lasting beyond just this grant. This is just really a planning grant to figure out how we move forward. So it's a little confusing, because often grants are to take action. We're looking for strategic sharing so that we can help the actual community service agencies, the CSAs, figure out how they're going to enhance their services and really meet the needs of young adults, because they're not showing up, and that there's a real reason for that, and we've got to find out the reason and then fix it in a way that sustains.
The problems that I'm primarily focused on are when we know a young person has a mental health condition. And so if we have family members who are often very concerned about very often they know that there's a problem. They know that the services their child has been getting as a child often are ending. They're often looking at services for adults, and they're looking at their young adult, and they're very concerned because they can see that it often doesn't match what they think their child needs or what their child is saying to them that they need. And then I think there are other times where families are feeling like their expectation is, oh, he's 18, he should be able to go off and head off on his own. And quite honestly, we don't expect that of many young people at age 18 to just launch, but to really be thinking about for the skills, the strengths that your child brings to being an adult, is it really reasonable to expect that they're going to be able to go on and, you know, have a job that helps them afford an apartment to live on their own?
I don't put nothing past none of them, and it's been a pleasure working there. It's been a good experience. This is all new for them and for myself.
What do you love about what you do?
Well, really, it is the chance to create programs with the help of the people that use them, who give direction to us in terms of building a system of care that allows people to move forward. And being part of a solution, really, which is about getting young folks away from the negative aspects of the risks in our communities towards being a solution to that, especially with folks like Luis, who I work with, somebody who's come through the system, benefited from the system, but is really was paying forward because now he's working for us, and he's putting his expertise that we don't have back into our program, which makes it all the more valuable, I think, when you look at it like that.
I think where I see the biggest discrepancy is that I talk about this developmental stage with lots of different audiences, and probably because I do it over and over again, when I go to talk to a new audience, I keep thinking, oh, they must know this by now. And what I think we're slowly learning in this country is that the whole transition to adulthood has changed from what we expected in the 1960s. What happened for the previous generation when they transitioned to adulthood was that really very easily you could finish up your schooling, you would move into your work life, you'd get married, you'd have a kid. By the age of 25, you owned your own home. And the transition to adulthood has changed radically for all of our young people. And it has made, in some ways, it has made it more difficult for those who are more vulnerable to move into mature adulthood. And I think in some ways we have a lot of research that shows that this is a much more difficult time of life, particularly for those who don't have as much, than what we previously understood. And that, I think, hasn't come across in parents' expectations for their children, in the way that we construct our policies of how we're going to support or encourage businesses and healthcare providers and other types of supportive systems to move young people into mature adulthood. So I think that's where I really see the biggest gap between what we kind of know, and maybe in an academic sense, and the way that we sort of live our lives in the real world.
We are the Social Marketing Committee of the Stay Together Grant, which stands for Success for Transition Age Youth. Our task on this grant is to use social media to develop and strengthen relationships with community service agencies and other community partners.
We have selected 6 community service agencies across the Commonwealth, one in Springfield, one in Worcester, one in Lawrence, one on the Cape, one in Boston, and one in Framingham. And we are working with those 6 community service agencies and their teams to create relevance for young adults.
So we did a clip because we often do trainings, and we did a great training with Janet Walker, and we also do trainings to kind of figure out how do we become better at advocating for youth. And what we want to keep in mind is we're going to use pieces of this in the PowerPoint. So you all have a PowerPoint here with you, so you may want to keep that out in front of you. Here's a PowerPoint. And kind of make notes like, oh, that would be a good clip for that, because that's the next thing, but we're going to kind of combine them. So it might be, we might start off with Mary, we might start off with Joan. So we're going to change the order of this and, kind of mix it up. So this is just kind of editing.
So I was just saying that we should chop it up so that at 4:15 on the video, we should have Joan McCula naming the CSAs.
The development of youth advisory groups has the slide that says development of youth advisory groups. It says a youth move, and I think that would be a Mary and a Danny piece.
One of the things I've enjoyed most with this grant in particular is how strongly we've partnered with young adults. It's very youth and young adult partnered. We have young adults on our steering committee, on all of our subcommittees as co-chairs. They're really helping us drive the agenda and move forward.
What the youth advisory groups are, we're getting a group of youth together to kind of talk about what they need in their their areas as far as resources.
We're hoping out of this grant that services are going to be more accessible to young adults, because right now people vote with their feet, and the reason why there aren't so many young adults taking advantage of these services is they're not meeting the needs that young adults want.
This grant is, in my eyes, excellent, as I have seen growing up and attending a place called Crossroads Clubhouse, that a lot of the young adults that came in and a lot of the young adults that I have talked to really have not been heard at all.
I'm on the committee because I'm a peer mentor, and a peer mentor is somebody with lived experience who has pretty much come back to help their clients recover in better ways.
Currently, we are working with the Lawrence area, Hyannis, and Boston, the Home for Little Wanderers. And what the YAG is, or the Youth Advisory Group, is that we're trying to get young adults that use the CSAs ultimately, which is a community service agency, and try to get them together and teach them some skills to then go and advocate for themselves in their treatment and what they would like to see.
I've been doing youth work for the last 10 years. I worked as a mentor to starting after-school programming in residential homes, so I'm just using my experience to do whatever I could do to help out.
I work for the Transformation Center, and I'm on the young adult team as a supporter. I've been a peer worker. I was one of the first paid peer workers in Massachusetts since 1989, and so I've really seen the peer movement grow. And at first, we didn't really include young adults, and it's really wonderful to be getting the youth voice, because all of us with lived experience have had others make decisions for us. But it's even worse for young people, that people just assume that if you're younger, you don't have your own opinions, you don't know what's best for you. And it's really our belief that every individual, no matter how old they are, they know in their heart what is best for them.
And we want to be heard, and we want people to realize that we and our families really are experts on ourselves. And as much as somebody can know about disorders or diagnoses, you know, families and youth really are experts on families and youth and should really be listened to.
The Social Marketing Committee is part of the Stay Together grant, and what the social marketing, a few of the things that the Social Marketing Committee do is using media in ways to promote the Stay Together grant.
Being able to help steer young adults and come up with ideas on how to get onto channels that young adults use, such as the Facebook and the MySpace and Twitter, is excellent, because then that'll be introduced to where a lot of electronic fanatic and a lot of like social butterflies on the web will actually go on and see what's going on.
We're really listening to young adults, and we've proven it. Like the young adults chose the name of the grant.
Young adults with mental health issues want what every other young adult wants. They want safe, affordable, decent housing. They want relationships, friends, intimate relationships. They want enough food to eat. They want jobs or volunteer activity where they're making a difference in the community. That's what everybody wants, and that's our belief. So we're hoping this grant will get us there.
Believe in yourself. Remember who you were in the beginning, what you wanted, your goals, your dreams, and never give that up for anything, no matter what you experience, because you can still make it, and you never let anybody tell you you can't.
Recovery and resiliency are real.